That's better.
Hello everyone, and welcome to our latest Ageism webinar with Euroageism. Today's webinar is on ageism in healthcare. So I'll be handing over to Hannah in a little bit, because she'll be running it from her side with the Euroageism researchers. But first of all, just a little bit of housekeeping. I am recording this meeting. And there's a live transcript, as you will see at the bottom of your screen. You can turn this off. If you're on an iPad, if you go to the top right-hand corner and go to ... or more, if you click on that and go to meeting settings, there will be live transcript or closed captioning, and it will be automatically set to on, and you can turn that off. On a computer, it will be in the bottom right-hand corner, and it will either say CC or it will say more, and then it works the same way from there. So I think that is everything. So I'll hand over to Hannah now, if you're ready.
Thank you very much. 1 second, I just share the screen. So a warm welcome to this online webinar also from the Euroageism side. We're delighted to have you all with us today to this third webinar. Like now we're becoming experts. My name is Hannah Köttl. I'm one of the 15 PhD students within the Euroageism program, and I will today lead you through the session of this program, and I'll now introduce some housekeeping issues that are maybe important. Please make sure that your full name is written in the name box. Please also try to turn off your microphones during the presentations. We will have the discussion session later, so you will have the opportunity to speak. But during the presentations, it would be great if you could mainly use the chat box. Like to the right, you can see the chat box where you can all the time share your thoughts or questions or whatever comes up. And please also remember to be aware that everybody can read whatever you write into the chat box. So maybe don't write too many personal issues if you don't want to do that. Eleanor already said, like, the session will be recorded, and there is this live transcript option that you can choose or not choose. So what is Euroageism? Some of you already know it since it's the third webinar, but I'll just introduce it quickly. So we are an EU-funded international network of researchers, policymakers, social and healthcare professionals, and scientists. And we are 15 students from all over the world, with all kinds of educational backgrounds, like from psychology to pharmacy, all kind of areas are there. And we closely collaborate with policymakers such as the World Health Organization, but also the UN, and we also work with Age Platform Europe, so all kind of policy institutions. Here you can see my fellow colleagues and students, other students, and our supervisors. And you can see also the areas of research we are engaging in. And many of our, or some of our, my colleagues, they are really engaged in healthcare and ageism in healthcare. And that's what made us decide to dedicate this webinar on ageism in healthcare. We will today have three wonderful presenters with us. I warmly welcome Jovana Prikic, who studies at Charles University in Czech Republic. We have Atiko Rahman with us from Linköping University in Sweden, and Abutunrin Aminu, who studies and who works at Robert Gordon University in Scotland. And we will afterwards, they will now present for 20 minutes, and afterwards we will meet again in group discussions to really have time to discuss ageism in healthcare from your experience. We have now all lived through a pandemic, we have, ageism during the pandemic became a big issue, and we all think that you have experiences or thoughts to share with us. But for now, I'm happy to hand over to our presenters. And I'll now stop sharing. So Abadunrin, you're welcome to share the screen with us.
Yeah, thank you, Anna. I think Jovana will be taking over from here now. Thank you. Pardon me, I think it should be Atika. So Atika, are you ready for your session?
Thank you, Abdulmin. And thank you, Anna. I hope everyone can hear me properly. Can you hear me, Anna?
Yes.
Yeah, okay, thank you. Thank you, everyone, and warm welcome to our third webinar on ageism. So in this webinar, we particularly focus on how ageism can be manifested in healthcare system. Next slide, please. We already know, we are already oriented about what is ageism, but I think I just want to remind this some important components that is associated with ageism. So from the classical definition of ageism, it refers to the stereotyping and discrimination because of the age, particularly for older people. So we found that, like, in ageism, there are 3 types of dimensions that could be associated with the manifestation of ageism. One, people could stereotype themselves, or people could be stereotyped by others, and they can face different types of discriminatory behavior from the society or from other people. So when we are talking about how it can be manifested in different levels of the society, so we found that, like, this ageism can be manifested by in macro level, micro level, that is, the people by themselves, they can think about some negative stereotyping or negative thinking about themselves. At the same time, the social network they are belonging, so this could also reinforce ageism. And in the bigger, in a broader sense, like when the institutional policies are formulated or institutional policies are implemented for older adults, different kinds of healthcare issues. So in that case, it could be manifested as well. Next slide, please. So now I will give you some statistical evidence that have recently conducted. If we see the first graphical presentation, here we see, like, this is a census that conducted by United States recently, and they projected projected of older adults, like, who are 65 years old and more. So in 2016 it was more or less 75 million, and by 2060 it will be close to 100 million. So we can see this huge number of population will require different types of healthcare services.
Sorry,
So,
Atikur, may I interrupt just shortly? We can hear some clicking noise. Maybe it's your microphone. I'm not sure. Maybe.
Okay, maybe.
Maybe it goes.
Okay. Is it okay now?
Now it's perfect.
Okay.
Thank you. Sorry.
No, it's all right. Thank you. So as I was saying, like, this huge number of population will require different kinds of healthcare services, and as they will need this kind of services, in this area there are a huge possibility negatively that could reinforce the ageism. And it can be, I mean, it can comes from physicians who are providing services, nurses who are associated with different kind of healthcare services. At the same time, people who are known as healthcare provider. So from these 3 levels, ageism can be manifested. So if I give some examples, like physicians who are directly giving some medication or prescription for older adults, they can be reluctant to do that. And from nurse perspective, they have some ageist thought or ageist feelings, and combining these 2 things, their attitude or their behavior can be different with the older adults. At the same time, if we consider the healthcare providers, it is very common that we see in healthcare facilities, people are considering, older adults particularly, older adults are considering as a they are treated as other general populations, and their different comorbidities are not that much focused when they are treating them. At the same time, any kind of comorbidities or any kind of health issues, when it comes to the older adults, these healthcare providers are generalizing them, and they are describing this kind of comorbidities as a natural effect of aging. So what are the possible impact, or what are the possible effects this ageism could create? So the current literature shows that there are various types of effects of ageism, particularly in physical. It can harm the physical condition, at the same time mental conditions. If we see the second graphical presentation here, the recent studies found that, like, it could cause some physical pain. At the same time, there are a lot of mental issues related to the effects of ageism. And basically it relates to the depression. It could create the anxiety. At the same time, in long run, it could create the cognitive impairment. So now I will give a very brief example about my research that I found. So I think it will be helpful to relate how ageism is really manifested in this area. So now, as Hannah said, I'm doing my PhD in Sweden, and my research topic is particularly focused on people living with dementia and who are 65 years and more, 65 years old and more. And I'm considering the Swedish context. So in Sweden, people who are 65 years and older, they are eligible to apply for any kind of elder care services. So among the whole population of older adults in Sweden, 76% people who are living with dementia and who are getting different kind of elder care services. But the surprising thing is, among these 76% people who are living with dementia, 60% of them are living at home who are getting very minimum level of elder care services. And among these 60%, almost 24% of them, that means 1 in 4 people living with dementia in Sweden, they don't have any kind of elder care services. So what could be the reason? So I just try to understand in a Swedish context, what are the main reasons behind this? So from my research findings, I found that age is a very significant predictor not to having any kind of elder care services. At the same time, people who are living with dementia, the duration of their diagnosis, it affects to get the elder care services. For example, when I focus on the duration of diagnosis, it shows that people who are in their early stage of dementia or who are younger age, that means 65 to 70 years old, these people in this cohort, they don't have any kind of elder care services. But this is very normal. When they are getting older, they are getting more services. But the main issue is people who are in this 65 to 70 years old, they also needs different kinds of healthcare services, which is they are not getting anything at this stage. So in my findings, I found like this age and the duration of dementia, both of these things together, creating different kinds of implicit ageism toward the people living with dementia. And I think more examples will come in our next slide. I will hand over to Abdurrahman.
Thank you, Atika. I think the next slide would be handled by Giovanna.
Yes, hello.
Hello.
Right, please.
The impact of ageism.
Thank you. Hello, I'm Giovanna, and I will talk about impact on ageism on health. So the ageism is harmful to all aspects of health, social, mental, and physical. Ageism reduces the quality of life. It increases risky health behaviors such as eating an unhealthy diet, not taking medications as prescribed, drinking excessively, or smoking. People with positive attitudes on aging tend to live longer, on average 7.5 years. Stereotypes represent overgeneralizations that all members of a group are the same. Stereotypes are always inaccurate, especially when it comes to age, because the older we get, the more different from one another we become. Stereotyping can help us to simplify the world around us by rapid categorization, and also it has a social function to emphasize a person's group membership. Older adults tend to be stereotyped as warm but incompetent. These lead to feelings of pity and sympathy, two common forms of prejudice towards older adults. Ageism starts in childhood and it is reinforced over time. Children as young as 4 years are aware of their culture's age stereotypes that are enforced by media. As we get older, we unconsciously internalize society's negative attitudes and stereotypes towards older people. Self-directed ageism is ageism turned against oneself. For example, some older individuals do not believe it is possible to learn new skills later in life and thus hesitate to enroll at university or take up a new hobby. Self-ageism results in people conforming to their society's age stereotypes, which in turn reinforces interpersonal and institutional ageism. Self-ageism may lead the older person to act as he or she is expected to behave, as a stereotypical older person. Hence, ageism may become a self-fulfilling prophecy. Stereotype threat is when we underperform or on a task due to worries about confirming a negative stereotype about our group. For example, an older person may do worse on a cognitive test due to anxiety about confirming stereotypes about older people being mentally slower. By behaving in a stereotype-consistent manner, older adults reinforce prevailing attitudes of reduced cognitive abilities in aging. Now, my colleague Abadundri will continue.
Thank you, Giovanna, for that beautiful slide. My name is Abajoin Aminu, and I'm joining you from Aberdeen, Scotland today. I'm going to be bringing the examples that my colleagues have shared or talked about in the earlier slides much more closer by discussing what we found in our research. My study was focused on frailty and aging in the aspect of health and social care. And what we already know is that frailty is expensive to manage, and it is linked to adverse health conditions like hospitalization, fall, and even mortality. And what we already know also from the research is that frail older individuals are at risk of discrimination, whether in terms of emergency hospital admission or in terms of having prompt diagnosis whenever they visit the GP, or even in terms of having transfer of care, for instance, from the hospital settings to the care home settings. So, but what we don't know is how much ageism contributes to frailty in the older population, and this is what informed my research. To start with, I did a review of the literature to look at what has been done in terms of ageism and frailty. And what I found is very, very similar to what my colleagues have initially shared with you, that age stereotypes were mostly researched by researchers in health and social care. Little or none was done in terms of prejudice and discrimination. This may be because there is really not so much information concerning the different angles of ageism, which includes prejudice, discrimination, and stereotypes. So it meant that only self-directed ageism has been looked at compared to other aspects of ageism, including discrimination and prejudice. So, and then also what I found out was that there was really no data available in terms of age discrimination in care home. For instance, while I was taking, looking at my study and looking at the way to recruit participants into my study, I found that in the whole of Scotland, there's really not so many available secondary data in Scotland that looked at age discrimination against older individuals, especially in health and social care. To further look at these variables, I then considered an existing data in the UK, which is called the English Longitudinal Study of Aging Data, called ELSA study. And this is a panel survey that includes individuals aged 50 years and over in the whole of in England. And surprisingly, what I found was that the prevalence of age discrimination that was reported by the participants in the study was up to 38% among individuals who were 65 years and over at the time the data was collected. This is very, very much high compared to some other areas in Europe, comparing with data from Europe. And another thing that I found from the study was that age discrimination is linked to frailty. Now, the way I designed this study was to look at the relationship between age discrimination and frailty at the time the data was collected, and to look at individuals who were not frail at the time the data was collected and see if they became frail after reporting the issue of discrimination or experiencing age discrimination, as it were. But not to stop here, another thing that we wanted to find out from my study was to see if there is an interaction between social participation, that is how much age discrimination affects the social participation of older individuals and its effect on frailty eventually. To my biggest surprise, because I would have thought initially, or my assumption was before going into the study was that individuals who have been discriminated were likely to avoid issues around or situations or events that led to their discrimination. And so my expectation was that individuals who have been discriminated are likely to become socially isolated. And then so my study eventually showed that this is not the case. But what eventually was apparent from the study was that rather than being socially isolated, older individuals felt the loss of social connection more rather than being socially isolated. And this had a huge impact on the overall influence of age discrimination on frailty. And so what that means is that a person is likely to feel more lonely rather than socially isolated as a result of age discrimination. And this is really interesting. And it is interesting because there is a saying that says that it doesn't matter the number of people you are living with or the number of contacts you are having, whether you belong to an organization or an association or religious body, or you're having contacts with your family or children, you may still be lonely even in the midst of other people. And this is what my study has really clearly shown. So I think that this is going to be informing future studies in terms of how age discrimination is viewed and its effect on frailty and health of older individuals. I want to say that another very interesting thing that my study showed is that though age is usually attached to frailty, and older individuals are usually described as it's been observed in this pandemic as being vulnerable because of their age, but this is really not the case because frailty is reversible, it is preventable, and only a fraction of the older population that I analyzed were frail. It wasn't as if the old population in the study were frail. So this is a very good angle to look at ageism in health and social care as it relates to frailty. So I'm going to this is going to lead us to the next slide, where my colleague Giovanna is going to be talking again to us about strategies to combat ageism in health and social care.
So since I am a pharmacist, I'm going to tell you briefly about the ageism related to the medication use. Older adults tend to be excluded from health research, even though many of the conditions are more prevalent in older age, and even though older people use more medications. Thus, the findings of such research may not apply to older populations. Ageism can contribute to inappropriate prescribing, polypharmacy or using more medications, and medication non-adherence, all of which result in negative consequences such as adverse medication reactions, hospitalization, increased healthcare costs. The literature review that I conducted showed that the prevalence of inappropriate prescribing is high in about 1/3 of older adults in Central and Eastern Europe, and also the preliminary results of my prospective study conducted in several countries confirm the high prevalence of inappropriate prescribing. There are several strategies to reduce ageism that have been shown to work. Policy and law, intergenerational contact, and educational activities from primary school to university and informal and non-formal educational context. In order to combat ageism, we should change the way we think, feel, and act towards age and aging, our own and that of others. and the awareness is the critical starting point. We should acknowledge our own prejudices about age and aging, and we all should value our wisdom and experience. Now again, my colleague Abadurin will continue.
Yeah, so I'm going to be sharing with you some of the initiatives that are currently ongoing against ageism, so that, of course, this is also an opportunity for us to be aware. And one very famous one is the World Health Organization Global Campaign to Combat Ageism. Very recently, the WHO published a report on global ageism report, which talked about the global campaign to combat ageism. They have developed a toolkit for global campaign to combat ageism. And this initiative is supported by over 194 member states of the WHO. And this is also it's integral to the United Nations Decade of Healthy Aging. So this is one very popular initiative that is currently out there, and the report is very much available for us to reference on the initiatives being taken currently concerning the ageism, combating ageism. Another one which I want to share with you today, and I must say that this list is not exclusive, so there may be so many ageism initiatives going on out there, but which we may not be aware of. So we would gladly want to hear your view about this in case you have come about any of those. But another one which I would like to share with you is the Stop Ageism campaign, which is a campaign that is powered by the Guild Living and Legal General. And their mission is to reinstate aging at the heart of community lives. They are delivering academically led initiatives in a way to enable independently living in the hearts of towns and city centers. And the last one, which I'm going to be sharing before we go to the question slide, I'm sure that Anna is already waiting to lead us into that session, is the Old School Initiative, which is an initiative to educate people about ageism. It is a clearinghouse of free and carefully vetted sources on how to combat ageism, and I hope that you would be we'll be having a very interesting session in the breakout rooms. So I'm going to hand over that to Anna.
Okay. I think you could stop sharing, maybe,
Okay.
if possible, or maybe you want to share. Okay, so we will now change into smaller breakout groups, discussion groups. So you're all welcome to share your experiences, your views. Like, we have heard 3 different perspectives, like frailty, medication management. Like, we have heard different areas. Sorry for the noise. I think they are doing some construction work in my house. And per group, one of the students will be there and will share the questions the 3 presenters have prepared to support the discussions. So you will be either with Federica, with Atikur, Itai, Giovanna, to discuss. So you will shortly receive an invitation to join a breakout group. Please click join. And then you will have like about 20 minutes to discuss the topic of ageism in healthcare, and with some supportive questions they have prepared. We will then meet again back here together after the 20 minutes. You will automatically come back, no worries. And then please dedicate one person in your group to share the major points, like to summarize some major points, so we can all hear what every group has found or has discussed. That would be really great for us, for all of us, to not miss any important information. So I now ask Eleanor to share the groups, and we look forward to the discussion.